Will a staffing accord unveiled by the Health Minister be enough to reassure nurses who are about to vote on their latest pay offer? David Clark announced today, he's the Minister of course, that district health boards, the Nurses Union and the government will sign an accord on Monday designed to improve public hospital staffing. Nurses have been at loggerheads with DHBs for months now in a row about pay and staffing. They are due to start voting online on Tuesday on a fifth revised offer, which is backed by the Nurses Union. Now, earlier on the programme, we spoke to a nurse who's also a moderator of the RNZ Please Hear Our Voices Facebook page. She told us that so far the accord has done little to appease the nurses they are hearing from, who say it's still not the commitment they need to know that safe staffing will meaningfully, properly be addressed. She talked about it in a very big picture way, and as the interview went on, we asked her for some examples of when understaffing had put patients at risk, and here's what she told us.
So one personal for me would have been that I was working on a PM shift, which is, afternoon until 11:30 p.m. and I had to work over until 4:30 in this particular case. And on that evening, I was the only nurse on to look after critical patients that were coming out of theatre. And on that particular shift, a baby came out that was... It was born by IVF, so it was to a mother who was really, really anxious. She'd waited for years and years to have this baby, and I was there to look after her. And the hospital was short-staffed that night. There was nobody on. I didn't have any backup at all. There was a team in theatre, but they were doing a thoracic case that night and couldn't come out. And the baby started gurgling and stopped breathing for a little bit. And I wasn't trained. I'd only been in that unit for a couple of weeks when I was in that situation. So I did what I could. I rung the alarm bell and nobody came. And I eventually managed to get hold of a phone after I'd managed to suction this baby and ring down and ask for an emergency team to be sent upstairs, and nobody came. And I rung again, and nobody came. And the buzzer was going off for ages. There simply was no emergency staff for me in that hospital for 50 minutes, and I was left on my own to deal with that emergency for 50 minutes. So the emergency team at that point were with another emergency, and there was nobody else that they could send me. So that's one case that I can tell you that personally I've been involved in. There's other cases that are going on that I can tell you about a nurse that's wrote into us that is in the mental health team of nurses, and they have been assaulted 41 times in their career. 5 times they've been hospitalised. And this particular nurse absolutely loves her job. She loves doing her job, and that's why she stayed. She's passionate about making a difference. She doesn't want to leave, but she's at the point now where after 41 physical assaults, she wants to leave. The last one she had was 2 weeks ago. And she was punched, kicked, hair pulled out, and she wasn't sent a backup nurse for 3 hours. She was put in a position where she was left in a room on her own with this patient, and where the patient would just hit and kicked her. And there's a no restraint policy now, so this nurse wasn't allowed to restrain the patient or have any physical contact with the patient at all. So they basically were just holding their head and trying to stop the punches from flooring them for 2 hours. And 3 hours later, they sent one more nurse down to help them in this particular area. The other nurses that were on the floor in this area didn't know what to do and didn't come in, felt they were underexperienced, didn't know what to do. The doctors didn't know what to do. They felt that leaving the mental health nursery was the best option because they were used to that kind of thing. And yeah, they went home and cried that night, cried and sobbed. So these are the things that are happening on the floor. And I mean, another one would be that our new graduate nurses, we get umpteen new graduates, messaging us in every night, every day, telling us about the horrific things that are happening on the floor, about them being bullied, about the understaffing, and about the unsafe work conditions. And especially, these new grads have probably been, they've only been in the job for a couple of weeks, and one of them got thrown onto the ward on their own with a set of high acuity patients. They didn't know what to do. They didn't know how to nurse them. They didn't know what drugs to give. Yet they were given 7 patients to look after on that shift on their own with no backup or no help. And it's just unacceptable. How can we live like that? How can we nurse like that We can't do it. And this is true, and this is real life. And these are the stories that we need the public to hear.
Nurse and moderator for the NZ Police Hear Our Voices Facebook page, giving us some examples.